But it's a stress a group of doctors across the nation are familiar with. Some on the front lines of COVID-19 have also been on the front line of treating patients affected by 9/11. 10 Tampa Bay's Angelina Salcido spoke to a local doctor who found the toxins in the air that day are now causing cancers and lasting lung damage.
It's hard to believe that it's been 20 years. When you hear people's stories, it was yesterday.
The collapse.
They're so real and the images are so vivid. I am the chief of pulmonary critical care at the University of South Florida. 20 years ago, I was just finishing training as a pulmonary critical care physician.
2,977 people were killed on 9/11, but as Dr. Michaud has seen, the tragedy touched so many more. 6 years ago, while being the chief of interventional pulmonary at NYU, she realized
the diseases that we see related to 9/11 are changing slightly over time. And I remember the first patient that I saw in New York. He was a firefighter who had never smoked a cigarette in his life, who came in and talked about his experience at Ground Zero on 9/11. You know, he talked about being on the pile and shoveling, and he had a really nasty, nasty lung cancer.
Patient after patient, she saw the same thing.
I started asking questions of the patients and asking them about their exposures. Had they actually been, where were they on 9/11? What were they doing?
Those walking in the rubble, the first responders trying to help, and anyone breathing in the air had lung damage.
And we saw people that had problems with asthma and sinus issues and reflux and all kinds of things like that. Now we're starting to see things like cancers.
Michaud says 80,000 of the 450,000 that were there at Ground Zero have been identified. That's why she's focused on helping those who may develop cancers from 9/11.
Those healthcare needs are real.
And lung research there helped shape how she treats critically ill COVID-19 patients now.
You always have to keep your mind open to something that could be completely different, something you've never seen before.
Dr. Michaud says anyone that was near Ground Zero within the first 6 months of 9/11 could now be developing cancers. They are eligible for help through the World Trade Center Health Program. We have more information on the designated physicians that can help at 10tampabay.com.